I'd like to offer some advice and tips, post-sedation tips after a sedation appointment. And one of the things, most people are ravenously hungry after they've been NPO for 8 hours or more. So feel free as soon as you're able to consume your normal diet. You might start off with soft foods, and certainly hydration is definitely in order. You'll feel much better, and the effects of the medication will wear off much faster once you rehydrate. The other thing to keep in mind is when our patients are sedated, they are not able to really bite down very hard because they're so drowsy, which means that the restoration that we place that day, whether it's a crown or even restorative fillings, whatever, will oftentimes be a little high afterwards. And so it's very common that we get a complaint that, of a sensitive tooth, sensitive to bite down, sensitive to cold temperatures. That's very common. It's almost a given after people are sedated, we're going to see that. And we either are going to follow up with you and see how you're doing the next day and find that out, or by all means, you need to contact the office and let us know you're having that issue. That's something that can be resolved very quickly and easily within just a matter of a few minutes. Also, one other comment post-sedation is that the time that people recover from the grogginess, the drowsiness that they had during their appointment varies wildly. And for some people, it's a matter of just a few hours and they're feeling back to normal again. By all means, when you leave here though, do not estimate that you'll be able to drive a car for at least 8 hours. And you have no business being on a car or motorcycle after a sedation visit for at least 8 hours. Those medications need to clear your system and you need to get back to normal. And you may think you're back to normal, but you may very well not be. So that's a very strong precaution. This is conscious sedation that we do for the most part. And it works very well. And there's a very good amnesic effect. So the chances of you remembering your appointment are pretty good that you're not going to remember a whole lot. But again, those are no guarantees. And many of my patients drift off and do take a nap during their appointment. But it's the kind of nap that I can push them on the shoulder and they wake up again, as opposed to much deeper anesthesia. But we're here to help make it as comfortable and as easy for you as possible. And we want you to enjoy your treatment here.